Oh, we're going? Let's go. Let's go.
You don't have to live in pain anymore. This is the podcast where you'll learn the stories, tips, and tools to get back to your path to health. I'm Dr. J. Dudum. This is Back at It with Dr. Decompression.
Welcome, Dr. Dudum. This is the Back at It with Dr. Decompression podcast, episode 8. Super excited. Today's episode is sponsored by Pillowise USA. I want to thank them for their support. And if you are looking for a new pillow or curious how their pillows work, they have 6 pillows. You choose based on the way you sleep, the firmness of your mattress, and the measurements around your neck. You can find a specialist on pillowise-usa.com, or you can contact our office, message us, and be happy to give you some more information. Thanks, Pillowise. Episode 8, we're going to talk about neck problems. In the previous handful of episodes, we've either talked about decompression, but we've really hinted, on my story with back problems, and we focused a lot on lower back problems. Today, we're going to dive into neck issues. So neck, cervical problems, disc problems, spinal stenosis, any type of issue related to the neck. And one of the biggest things that we're seeing with neck issues today is a syndrome that's called upper cross syndrome. That's a big broad term that's a cause of a lot of problems. What that means is if you look at someone, you're at Starbucks waiting in line, or you're at Target, or you're somewhere and you're waiting in line, look at everyone, or if you're at work now at your desk, everyone is hunched forward and their face is down. So this here, if you're listening, sorry you can't see it, but if you're watching, I'm leaning forward, my neck is forward. That causes a lot of muscle imbalances and it causes a lot of joint stress. What happens is the muscles in the front of your neck become weak, and the muscles, you get this super tightness in your back and your upper traps and your levator scapula, all these muscles here. A lot of people come to us with upper back neck tension. That's due to upper cross syndrome. You're looking at your phone, you're on the couch at night watching TV, or on the laptop. Over time, we're not talking about weeks, we're talking every day, weeks, months, years of this. Your spine, the stress, your body starts to feel it, and your discs start to wear out. And maybe you had a previous sports injury, or maybe you had a previous auto accident 30 years ago, or a previous rugby injury or something, and it was kind of dormant. That injury was dormant. But every week, every month, every year, you're sitting and you're causing more stress on that neck. That is going to creep up over time and cause problems. It's kind of like the last straw that broke the camel's back type of mentality. So you've got a lot of compression on the joints, and the muscles in the front of your neck are weak. The muscles in the back are tight. Your pec muscles become tight and contracted, and then your mid-back muscles become weak. So it's like this forward-leaning posture. That's the main reason of the problem. Obviously, if you get in a car accident and you hurt your neck, that's a problem. But what we're going to focus on now is that's causing a problem, and then how do we solve the problem? And we're going to use a case study today. What I mean by case study is, again, like last episode, in episode 7, we talked about pre and post MRI of a patient. So today we're going to talk about getting an MRI, but we're going to use a specific patient, and we're also going to talk about a pattern that I'm seeing in the office through my 13 years of clinical experience, a typical pattern and how we can solve that pattern, okay? So this patient, we'll call him for purposes, we'll call him Joe. His name's not Joe, we'll call him Joe. Joe was frustrated. Joe had been having neck pain ear pain, ringing in the ear. He had pain, again, if you're watching, you can see, but if you're listening, about the size of a tennis ball right next to his scapula, like in the middle of his back, right under his neck. Very common place to have neck discomfort and referring pain from the neck. Very common. That'll lead into the trend that we're seeing. And his fingers, these fingers, the thumb, the index finger, and the middle finger were getting numb. So tingling in the fingers and numbness, neck pain, ear pain, and a tennis ball type pain in his upper back. He had gone to certain providers, Joe was given medications for the problem. Joe had suffered for a year and a half with the frustrating part with our systems, our healthcare systems, not to go on a tangent, but the frustrating part with Joe, no one knew what was wrong with Joe. He's had this problem for a year and a half. Joe didn't want to take medications. No one told Joe what was going on. Is it coming from the neck? Where is it? He had tried massage therapy. It gave him some temporary relief. He tried other things, some manipulations of spine. Again, temporary relief. Joe had found us from a referral from a friend. Ironically, the friend had the exact same problem. So you're going to learn in future episodes about why something worked for one person but not the other, or vice versa. That is a segue to future episodes. He had the exact same problem. Referred Joe to our office. After talking to Joe for 30 seconds, I knew what Joe's problem was, because I've seen it for 13 years. We talked to Joe. Joe, you need an MRI, because I only work with people if I get an MRI and I see exactly what's under the hood of the car before I start working on the car. As a mechanic, you don't want me to, you have an oil leak, let me just start fixing something. No, I want to investigate what's going on in the problem, get some imaging, and I want to solve exactly what's wrong. That's how our office operates. So we get an MRI. As I suspected, Joe had a disc bulge in the lower part of his neck at the C5, C6 area. He had a 3 millimeter disc bulge, meaning for our watchers out there, for everyone watching, he had this red tissue. Again, if you're listening, sorry, but I'm pointing to a disc bulge that's touching a nerve. This is the problem. That problem causes a whole lot of issues. It causes tingling down the arm into these fingers. It causes a joint referral down where that tennis ball was in his scapula. And it causes facet issues, which could also lead to pain in his ear. Very common problem. I see it every single day. We found the MRI. I knew the exact treatment plan to help him because I've helped hundreds and thousands of patients just like Joe. We weren't going to do massage because that didn't help him before. We didn't do just chiropractic treatment because it hasn't helped him before. We didn't do medication because it hasn't helped him or won't solve his problem. Point of the story is, if something is not working for you after a few weeks or a few months, you need to do something different. So the timeline in which you heal, you should be improving. Guys, you should be healing. If you are listening, you should be healing at a certain percentage. It could be 2%, it could be 20%. Everyone heals differently. But you should be progressing. There are ups and downs. It's a roller coaster. You have some weeks good, some weeks bad, but as long as on a general theme you're improving, you're on the right track. It could be decompression or massage therapy. It doesn't matter. But there's a progression. You should continue to improve with your symptoms. That means you're on the right track. So keep doing what you're doing. Sorry, back to Joe. Joe, we're not going to do the same thing because he already had done those things. And I had seen this play before. It's like watching a football game and knowing the formation and knowing the play. It's the exact same thing. I knew what was going to happen. I knew what to do. We set Joe on a 8-week treatment plan. Joe got spinal decompression, a few chiropractic manipulations. He got therapeutic exercises. He's doing massage therapy, and he's working on our power plate rehab machine. What do you think is happening to Joe 8 weeks later? Think what you think's happening. Joe's getting better. Joe he has no sensation, no loss of sensation in these 3 fingers. For you listening, the index finger, the first finger, the index finger, and the middle finger. Fingers are better. His ear pain, that plugging feeling of his ear, completely gone. You know that tennis ball size tightness in his upper back that most of you experience with upper cross syndrome, especially if you sit for work or on your phone a lot? We all have it, okay? That tennis ball is now the size of a pebble. It's reducing in the size of tension. 8 weeks. Amazing story. Joe's getting better through our spinal decompression, which works for neck and cervical issues. So not only did it help Joe, but it helped his friend that referred Joe to our office. That's one example. The second example is it's myself. So through work and life, sometimes I get some tension in my neck, and adjustments help, massage helps, all that, the other things we've talked about. And sometimes I just need to decrease the stress in my neck. So I get on the decompression table for my neck, whether it's a headache, whether it's just neck tension, and I gently get pulled apart at a very specific weight, at a very specific angle. And what does it do? We've talked about it before. Let's review it. If you're watching, you can see. If you're listening, I'll describe it for you. It's a gentle pull. When we pull like that, it's opening up that disc space ever so slightly, and it's allowing nutrients and oxygen and blood supply to get to that disc, and it's taking pressure and inflammation off of the nerves and the joints. It's creating a sense of ease for our necks, and that allows our brain to tell our muscles to just chill and calm down. It works really well. It worked extremely well for cervical or neck cases. I got asked a question the other day by another provider actually. What percentage of neck cases do I see relative to low back cases for spinal decompression? I see about a third. So 33% of the cases that come in are neck related issues. The other 66% are low back issues. We see roughly 60 to 70 patients per day that we help every day with spinal decompression. So we see about 40 patients with low back and 20 patients with neck issues. Decompression is not the only thing that helps these neck issues. You need things like exercises and manual therapy and those are all great. But the cause of a lot of these neck issues, as we talked about, the cell phones, sitting on a couch on the computer, how you sit at a desk. If you are listening, a very good rule of thumb is the 90-90 rule. So look at my hands. If you're watching, my hands are at 90. There's a 90 degree here. So if your hands are on the table and you reach too far forward, that's going to cause distress. If your hands are nice and tucked, my shoulders are back, and my head is allowed to not be too far forward. The other thing is the monitor that you're looking at should be parallel to the ground or perpendicular to your eyesight. So I'm not looking that much at this monitor, but if I was looking at this monitor all day, every week, every month, this would be a problem. That's why I'm sitting upright, glancing at it. That's a tip. So when you're at home working or when you're at work, think about those two things. if you are curious if your monitor and you're sitting in the correct posture, please have a coworker or a family member take a photo. Our Instagram is at Dudum Chiropractic. Send me a message on Instagram. I'll give you some advice on what to do. So this really sums up episode 8 about cervical issues. We've talked about some case studies and a lot of patterns that I see every day as far as upper cross syndrome, leaning too far forward, and what those symptoms present as. I also gave you a snippet of, hey, I use spinal decompression on my neck. I don't have a disc bulge in my neck. I don't have a serious condition. It just helps relieve tension in my neck, and I do it every so often. So we've talked about a few different cases, giving you some at-home tips. So hopefully you guys learned a lot. Hopefully you, if you're listening, learned a lot of information that you can apply today, or maybe it sparked a question in your mind about what's going on. I'd love for you to message me or call us or email us. So again, thank you for watching or thank you for listening. You can follow me on Instagram at Dudum Chiropractic. The YouTube channel is Dr. Dudum. And I really want to thank our sponsor, Pillowise USA. When we sleep, we're sleeping for 6, 7, 8 hours a night. If I'm working with someone on a cervical or neck problem, I'm pretty much always discussing how they're sleeping and the pillow they use to sleep. If they're not progressing the way they should and they're kind of digging their heels in the mud, or they're running in quicksand, so to speak, I might recommend a new cervical pillow. The pillow I recommend is Pillowise. Pillowise has a very specific algorithm that they've designed where they take measurements. We take measurements of your neck, the circumference, the distance, a few different measurements. We calculate that with, do you sleep on your back or do you sleep on your side? Because that would require a different pillow. And then, is your mattress firm? Does it give at all, or is it soft? Does it give a lot? Those factors help determine what kind of pillow. There's 6 pillows that they have. I personally check out their website, pillowise-usa.com. I personally am a blue pillow, so the staff uses the pillows. Their families use the pillow. They're amazing pillows, and they're an adjunct to the treatment that we do to help people with neck problems. So want to give a shout out to them. Check them out, Pillowise-USA. Thank you for the sponsorship, and thank you for the products for helping me, myself, and the patients. This is episode 8, talking about neck issues. Don't forget to follow us on podcast. And lastly, I'm excited for episode 9, okay? Episode 9, we have a very special guest, Dr. Brian Gatterman. He's a chiropractic physician. He's also a chiropractic radiologist. He was a professor of mine at Life Chiropractic College West. Jeez, that was 14 years ago. And we talk weekly about cases, strategies, what films should we be taking. We analyze films. I'm excited. We're going to have a conversation, and we'll even dive into a few patients that we were struggling with, and he gave us some advice, and boom, patient got better. So really cool, excited to have him on. So check out episode 9, guest speaker, Dr. Brian Gatterman. I'm Dr. Dudum. This is the Back at It with Dr. Decompression podcast. Thank you for listening.